Hey guys, thanks for tuning in. This is Chad Robbins. We're talking about Brazilian butt lifts. And we have a patient here today who is getting prepared to move forward with that. I'm going to talk in general about what it is we do in the situation. We're also going to use her. She's agreed to serve as a model for this, and we're going to use her as an example and tell you about the upcoming procedure. But Brazilian butt lift is just one of 3 ways we do augmentation of the gluteal area and buttock area. In Brazilian butt lift, we actually use a liposuction cannula to harvest fat from one part of the body. We process and isolate those fat cells from the fluid, or the aspirate as we call it, and then we re-inject those fat cells into the buttock. And just like a skin graft, those fat cells are transferred to their new home where they set up shop and live for the rest of their life. So we get about 70% take, meaning 70% of those cells survive and live in the gluteal area where their new home is. 30% of them don't survive, so we know that there's going to be some volume loss. Most of that happens within the first 2 to 6 weeks, and so at 6 weeks, in general, the volume that you have at that point is what you get long term. And there can be weight fluctuations, and just like fat cells in any other part of your body, they will get bigger or smaller depending on whether you gain weight or lose weight. When I look at a buttock, I'm looking at gluteal volume. When I examine the other parts of the body, I'm also looking at what we call donor sites. In general, at least in my practice, Brazilian butt lift includes 3 donor sites. Sometimes we do more or less, but usually it's additional work in that situation. I like to tell patients at the consultation how much volume they'll be able to get from the Brazilian butt lift, and we quantify that. In general, I'm able to estimate within 100 milliliters what I think their volume is going to be, and we'll do that today. This is Jennifer, and she's agreed to let us film this. She has upcoming a Brazilian butt lift. She's already had a tummy tuck, so some of those best donor sites we get from the abdomen are not what they used to be, because that came out with the tummy tuck. We will, however, be taking what fat she has right here. This is going to be a donor site. We're going to use the flank and back area as a donor site. And I really like using this, not only because we get great fat from this area, but sculpting out this area helps narrow the waist, and it helps with the contour and profile, defining and framing out the shape of the buttocks. One thing I try to pay attention when I do an exam in this scenario is I'm looking at the shape of the hips. The shape of the hips is defined by the pelvic brim, which is the top of the pelvis, and the greater trochanter of the femur. In some people, they have square hips, narrow hips. Some people, the greater trochanter sticks out more than the pelvic brim. It's almost more of a pear shape. In some cases, we see the exact opposite, where the pelvic brim is much wider than the greater trochanter. In general, or at least the most desirable aesthetic, is sort of a classic narrow waist, rounded hip, where this area between the pelvic brim and the greater trochanter has a nice gentle curve, and that's what we're going to go for. We will have some fat here after we go to these donor sites and remove the fat, isolate those fat cells. We'll have some fat for the buttock area, which of course we will volumize here, but we'll have a little bit left over, and we're going to try to round out these hips as much as we can. That's not true for everybody. Every case is individual. Every case is different. And we do try to individualize or customize our treatment based on each person's needs. We've got Jennifer here, and she's 8 weeks post-op. We did a Brazilian butt lift using the abdomen, back and flank, and also her thighs as the donor sites. And so she's back for 8-week post-op. We've done some after pictures just to demonstrate how dramatic the results are, to make sure she's happy, because we want to make sure she likes the results as well. I'm very satisfied with the results, and I'm just going to kind of walk you through our exam today. So right here, as you may remember from before, she had already had an abdominoplasty, So her tummy's nice and flat, but we were still able to get some good fat grafts there from her tummy and also from her thighs. But in profile here, we spent a lot of time doing liposuction on the back and also on the flank area to really show that volume and that contour. And of course, we had a really nice result from the fat grafting. We were able to get good volume in here. You can see that her waist is narrower from the liposuction, and also that we've got great volume here. We know that about 70% of those fat grafts are going to survive, about 30% are not going to survive, so we overfilled her buttock, and this is what we're left with. 8 weeks, we know that this is going to be meaningful volume, which is going to be reliable over time, and I'm very happy to see that. Thanks.